All right. Well, good evening, everybody. I'm Nidhi Razdan. Welcome to Geetam University's webinar on conversations around COVID-19. We'll be talking to an expert panel of doctors for the next hour or so, taking in all your questions, anything that you want to know about COVID, how to handle it, any questions you have on symptoms, on medication, on policy, vaccination. This is your opportunity to ask this esteemed panel of doctors anything that you would like. So we're going to take in as many questions as we possibly can. We already have quite a number of questions coming in. I'd like to introduce our first guest this evening is Dr. Srinath Reddy, the president of the Public Health Foundation of India. Dr. Reddy, thanks so much for being with us. If I could jump in right away with my question first. You know, right now, what everybody's worried about, apart from COVID itself, is this phenomenon called black fungus. Can you explain to us, Dr. Reddy, who does this actually impact? Is it contagious? And what do we need to be careful of regarding this disease? You'll have to unmute your mic, sir. Sorry.
Thank you. Anybody with a depressed immunity is likely to be more susceptible to fungal infections. As you would have heard, people who are on long-term antibiotics or diabetes used to get candidiasis, or what could be called the thrush or even the white fungus. But here we are seeing this mucormycosis coming in people who are usually immunosuppressed because of the use of steroids or some other immunosuppressed drug, or when they are immunosuppressed because of some other reason, which may be a debilitating disease. Now, it is possible that the fungus itself enters when oxygen is administered by bubbling through water, which may not be entirely sterile. So whether it is the oxygenator or the oxygen cannula that is connected to the mask and the nose or the humidifier, if the fungus has entered the system, then it may gain entry into the body, but it usually requires a body that is already having a problem of suppressed immunity. Now, unfortunately, people with diabetes or pre-diabetes already have a slightly suppressed immune response. And if they're on steroids, the diabetes flares up as well. And a variety of changes take place of a suppressed immunity because of the steroids, increased and uncontrolled blood sugars, and entry of the fungus through the oxygen supply system, which is trying to actually provide the required support to the person whose blood oxygen levels are low. Now, mucormycosis has occurred earlier too, outside of COVID situation in immunocompromised people. But here we are seeing a sort of perfect storm where you are seeing people with steroid usage, sometimes even injudiciously so, often even outside of hospital when it's not really required. We are also seeing oxygen being administered at home, and we are also seeing oxygen administered in a variety of hospital settings. And if we are not careful, firstly, we are aggravating the diabetes, and the pre-diabetes converts into diabetes as well. The immunity is suppressed, and the fungus which may enter through any of these channels gets an opportunity to grow and thrive. That is where the problem is. So we have to ensure, firstly, that our use of drugs is proper, appropriately directed by scientific knowledge, and not inappropriately overused. Secondly, we ought to see that the water we are using is absolutely sterile and frequently changed.
Okay, this is very, very important. I think especially for people who are administering oxygen at home through concentrators at home, because many people have had to resort to that. I'd like to also welcome Dr. Rajesh Parekh, the Director for Medical Research at Jaslok Hospital and Research Center from Mumbai. Dr. Parekh, thank you for being with us. Dr. Deepak Raheja is also with us, the founder and director of Hope Care India. And Dr. Raheja, I really want to ask you so many questions on how mental health has been affected at this time, and what people can do. So I'll come to you in just a moment, but we're already flooded with questions. And related to the question on black fungus, I'd like to take this to Dr. Parekh. Ashok Chakravarti Chetty wants to know, what is the difference between regular nasal sinusitis and black fungus? How do you know that the two are different? Dr. Parekh, you'll have to unmute your mic, sir.
Okay, I think that's an excellent question. And, before I respond to it, I'd just like to add something to Dr. Reddy's, excellent amplification of all that happens with the black fungus. There's one more factor, and I'm not sure if Dr. Reddy covered it, but it does concern me, and that is the use of industrial oxygen. So because we are running short of oxygen, in a lot of places now, industrial oxygen is being used as a substitute for medical oxygen. Industrial oxygen does not go through all the purification processes that medical oxygen goes through. And so there is the hypothetical possibility that some of the fungus could possibly be originating in the oxygen itself. As to how does one distinguish this from nasal sinusitis? Well, first of all, it's important for us to understand two things, and they're paradoxical. One is that while mucormycosis, or the black fungus, is extremely rare, it's very rare, though it can be fatal more than half the times. On the other hand, the fungus itself, mucormycosis, is prevalent. It's all around us. It's in the dust, the air. I dare say some of us are harboring it even as we speak, in our nostril and in our nasal cavities. And in ordinary circumstances, it does not pose a threat at all. But as Dr. Reddy explained, in certain extenuating circumstances, such as compromised immunity, either due to COVID-19 or due to diabetes or due to the rampant misuse, I might say, of steroids with suppressed immunity, mucormycosis gets an opportunity to proliferate. How it differs from nasal sinusitis is, now there are two types of this fungi. We needn't get into the details of it. One of them, affects the eyes, and the other affects the nasal cavities. So in regular sinusitis, one of the symptoms is, of course, pain in the sinuses. Our sinuses are here and here. And one of the commonest tests one does to figure out if it could be sinusitis, is just compress here, press hard on the sinuses here, and see if there's pain. Another way people do a very simple test is just put their head down. Just lie on the bed and put your head down and see if it hurts over there. But other than that, nasal sinusitis tends to be, most of the times, a chronic condition, and it is very amenable to simple things like steam inhalation. On the other hand, if it is indeed what is now termed as the black fungus, though I personally don't prefer that term, but if it is so, then it progresses rather dramatically and it spreads very fast. So there is a difference, but I don't want this to be a one-on-one on how to diagnose it yourself. You're always safe talking to either your family doctor, or if you have the luxury of ENT consultation, which isn't that rare now due to the ubiquity of telemedicine, it's better to take a visit.
But it's not contagious, right? Just to re-clarify that point, it's not contagious. If somebody does get it, they can't infect others around them.
They could theoretically. All fungi are infectious and could spread, but it would mean sneezing in the proximity of that person, and sneeze droplets do not travel very far, and then that person inhaling it, and that person also having at that point a compromised immunity due to the conditions that we mentioned. So the possibility is very low. It's not probable at all. But again, I would assume that people are already having masks on and maintaining a certain distance from other people, even within the family. Under those conditions, extremely unlikely, improbable.
Okay, before I go on to the string of questions that are coming in, I'd like to go to Dr. Raheja for an opening comment as well. Dr. Raheja, this has been an extraordinarily difficult year and a half for everybody, and it's really taken a toll on us. And anxiety, for those who suffered from COVID and those who have been caregivers, we see that, in a really big way. What has your experience been with those who are coming and talking to you about this? I had COVID. I can give you my example, and I have been through severe anxiety because my father had it. and I'm still not able to sleep. So what does one do in that situation?
So interestingly, like you rightly said, it has been an unprecedented year and a half for all of us. We did not know of a situation like this. We did not have the armamentarium and the mechanisms to deal with it. Starting from, like you said, somebody suffered from a COVID-19 infection, and the kind of ambiguity and the uncertainty that led to the anxiety. And then in the continuum, if we look at India, and if you look at the second wave where people died and there was a colossal collapse of a lot of services in terms of, like Dr. Reddy and Dr. Parekh said, use of industrial oxygen, oxygen not being available, just trying to make makeshift arrangements, and the kind of mortality that was in the environment, which led a lot of people to start dealing with the anxiety of what if I'm next? I
Yeah.
mean, for the patients, for the carers, for the families, friends who called me, or any of my colleagues, none was hesitant in utilizing their resources to be able to muster subsequent resources for people who were seeking help, leaving us also with the ambiguity that God forbid, if I was in that situation and if I reached out, will my phone be answered because I've already exhausted and asked for enough oxygen or enough hospital beds or ICU bed. So it has been a very challenging period for people at large, for medical professionals. I would go a step ahead and say also for mental health practitioners. If you heard recently the Max doctor who committed suicide, he was recently married, his wife was pregnant, and the only stressor, as we know of, majorly that he was dealing was that day and night he was in that COVID ICU, where he was seeing patients dying in and out, day in and out. So the kind of anxiety, the kind of uncertainty, the kind of morbidity one has to deal with is absolutely a state of helplessness and despair. And I think in the continuum, I think most medical practitioners, including colleagues like Dr. Parekh and Dr. Reddy and all other medical colleagues, have been talking very voraciously and have kind of acknowledged that mental health and physical health will have to be seen in a continuum. It is your mental health state
Yeah.
that led to the possibility of your evoking a strong immune mechanism that helped ward off a possible contraction of the disease. So it is the state of immunocompromised individuals, state of people who mentally felt fatigued, who felt helpless, who got into that state of despair, possibly enhanced the damage that the virus was able to do. So these are definitely tough times. The way patients, people are talking about it. I mean, people have also in hush hush begun to say, if you're going to have a perhaps a PTSD or a mental health pandemic within the pandemic, or a mental health epidemic within the pandemic, where as we recover, how much of there's going to be loss of economy, people's livelihoods are changed, working from home, carrying the expressed emotionality, being within the family for long uninterrupted hours has been therapeutic for some, has been
Very
detrimental
broken
for
for
some.
others. Yeah,
Yeah,
yeah.
yeah,
I
yeah,
want to
yeah.
talk about that in some more detail with you, because we've seen all kinds of emotions, and we need to look at solutions on how to deal with that. Dr. Reddy, there's a question from Jaya Kota, who wants to know what is the probable reason for people who've died after ostensible recovery. They may be sent home from a hospital, but somehow their condition deteriorates within a few days. She just wants to understand what could be the reason for that.
Well, we know that people who have seemingly recovered still may not have completely recovered from the point of view of their ongoing inflammatory state. And it is possible that the inflammatory state may flare up again and have a serious consequence in terms of organ damage, tissue damage. So therefore, it's important for us to keep following up as well to make sure that they do not have this kind of a problem. And that's why a variety of parameters are assessed, including some of the clotting parameters. One is inflammation per se, but also the fact that many of these people are also prone to thrombosis, particularly in the veins, but also in the arteries as well. And we know that some of this clotting tendency can manifest even for some weeks. That is why people are now being advised anticoagulation, which may continue up to 3 weeks rather than just in the hospital. So the idea here is to both reduce the inflammatory response, but also to reduce the thrombotic events or the clotting events. And some of these problems can occur even after discharge when the person has gone home. So some of the treatment needs to continue there as well.
Okay.
Maybe if I may add
Yes, Dr. Parekh.
to that excellent description, there are two other factors. Of course, what Dr. Reddy said is the most common one, which is a resurgence of the existing infection, which has not settled down completely. But there are two additional ones. One is relatively rare, and that is a reinfection in a person who has already recovered. The person either gets lulled into a false sense of security or still continues to be immunocompromised and gets a reinfection. That's not that common. But there is a third factor, which is much more common, and that is the sequelae of the original infection. Cardiac, renal, because the virus attacks different organs. The lungs are the commonest organs, but also the heart, sometimes the brain and the kidneys. And now what is emerging, and this is something we're researching at Just Look for quite some time now, is what is called long COVID. And this is people who have recovered, but yet harbor some of the damage done by the virus in its first onslaught on the body. And then after a lull, it takes over. And that can too contribute to mortality in people who've recovered.
Okay, I'd like to ask Suraj Arvind to ask his question. Suraj Arvind, are you there? Please unmute your mic. Yes, please go ahead and please specify to whom you're asking the question.
Mine is a general question, ma'am.
Okay.
Before this COVID, we also have other viruses like Ebola or AIDS, HIV, something like that. Often after every 2 years or 3 years, we come to some viruses are named and they just affect the people. Now, what were these viruses doing till now? Is it just they are newly formed because of some successful or failed experimentations in some laboratories or something like that? And can we expect these kind of viruses to come in the coming years as well? If not COVID, something else will come and affect us.
Yeah, that's a good question. Dr. Reddy, would you like to take that question?
Sure. Over the last 60 years, there have been several new infectious disease outbreaks, and 70% of them are zoonotic in origin, that is, animal to human transmission. That is not because animals have suddenly become malevolent towards human beings, but we have actually set up conveyor belts for the viruses to travel from wild animals, from the forestry, where they've been confined to a fairly quiet life, by deforestation, rampant urbanization, and also extending our agriculture for a variety of reasons closer to the forestry and then damaging the forests. And we find that particularly captive animal breeding also is a reason why we actually allow these viruses to come and attack the veterinary population, and from there they can transfer to the human population or sometimes directly to the human population. But we must recognize that there are different modes of transmission. Some of them are respiratory viruses, some of them are entered through other routes of infection. But we know through bodily secretions, for example. But it is true that many of these viruses are able to gain easy entry into the human body because of some of the things that we do, particularly our living in crowded communities, a lot of travel gives them an opportunity to gain entry into a huge host of human community, and they tend to proliferate fast. Over a period of time, some of them may actually grow milder. Like we know that some of the common cold viruses, which are also corona, some of them are coronaviruses, must have started off several years ago in a more virulent form, but they, over a period of time, they become milder. So they can actually mutate even to milder forms. But whether most of these are considered to be zoonotic, whether there is a lab origin for the current virus or not is still a matter of great controversy. I'll not comment on that. But I believe unless we are also ecologically responsible, we will not be able to contain the outbreaks of these viruses for quite some time to come. And therefore, while we must do everything to try and identify these viruses at the earliest and contain them, we must also have what is called eco-surveillance or One Health surveillance, One Health systems, in which right from wild animals in the forestry to veterinary animals to humans, we study how the viruses are emerging and migrating, and we can get early alerts of whether pandemics might occur or not and take very early steps for containment. And that's why even the government of India now says that they're going to invest in a One Health program, and the WHO has been advocating it for quite some time.
Okay, I'd like to also invite Dr. Farah English. She's the Director of Internal Medicine at Fortis Hiranandani Hospital in Mumbai. Dr. Farah, thank you so much for being with us. Let me just straight away ask you a question that Yashasvi Mantha has asked. That is it safe for people to order food from outside? What are the chances of getting infected from food or packaging? I remember last year during the first wave, we were all spraying boxes, packages, and being careful about that. But there seems to be some mixed messaging about that now. Dr. Farah English.
Yeah, good evening, everyone, and thank you for having me here. Initially, when the pandemic had started, that time it was said that the route of entry of virus is through droplet, that is airborne, through respiratory secretions when an infected person coughs or sneezes, and even when you talk loudly, you excrete out viruses, and also it was through fomites. But then over a period of time, it has come to know that the fomites are not so much responsible in transmitting the infection as other droplets. But still, you have to be careful. So there's no harm in ordering food packages from outside, but then you may better sanitize it. You may sanitize the food packages from outside. But then WHO has also said that you can order for food packages, and fomites are not that much responsible for transmitting the infection as it was thought earlier. More so, it is because of the respiratory droplets, the droplets which are coughed out or sneezed out.
All right. There is a question from Vedavati. Vedavati, are you there?
Yes, ma'am.
Please ask your question.
Yeah. Good evening, sir. My question is the favipiravir medication of 1400 mg for a duration of 14 days. Will they cause increase in blood sugar levels?
Okay, Dr. Parekh, would you like to take that?
I didn't get the name of the drug very clearly.
What is the name of the drug?
Audio.
Favipiravir.
Oh, the FaviFlu.
Okay.
Yeah.
Yeah. All right.
Alternate to FaviFlu.
Yes. So your question was, if it's continued for more than 2 weeks, will it cause
increased blood sugar levels?
Yeah, will it shoot the blood sugar levels?
Yeah.
Let me tell you one thing, and this is in general for the questions that come in.
Yeah.
I think in a forum like this, and I don't mean to be condescending, Vedavati, I hope you'll pardon that. It's better to take more generic questions, because some of these answers are tailor-made. They are for an individual. They depend on the person's condition at that time.
Yeah.
And sometimes it's not prudent for any of us, and I hope my panelists agree with me, that to generalize on a question like this, because people unfortunately take us more seriously than they should sometimes, and then they act upon this. So I do not want somebody, I have my opinion, and there is the medical opinion that is there, and I will say that, but please cross-check with somebody. I personally believe, based on data, we've reviewed more than 1,600 research papers and books in the 2 books that we wrote, the coronavirus book more than a year ago, and more recently the vaccination book.
Okay, I think Dr. Parekh's link has frozen. This is reminding me of my TV days. I'm hoping it just comes back, that the Wi-Fi comes back. Dr. Farah, would you be able to sort of take on this question? Sort of more general. Oh, Dr. Parekh, no, I think he'll have to probably. Dr. Parekh, are you there with us? I'll try one more time.
Back?
Yeah.
Okay.
Yeah, you're back. Great.
Yes, I can hear you loud and clear. Let me see where I was. I don't know at what point I got frozen, but now that I'm unfrozen,
we're just starting actually to give the general sort of overview about your opinion.
So, research doesn't indicate in any compelling manner that there is even a role for this in COVID-19. So I think that's an issue we need to address first. before worrying about potential side effects and the duration of the side effects. I mean, if there is no evidence to indicate a role, why consuming it in the first place? On the other hand, one must humbly admit that medical practice across the world, and more so in our country, is very idiosyncratic. The doctor has a large latitude to prescribe what he believes is appropriate for a particular patient. And so you are then weighing the doctor's experience and his clinical judgment against a very abstract data pool, either by analysis of certain studies or even meta-analysis. And sometimes it's just better to trust your physician. If not, of course, take a second and a third opinion. But my cautioning you or even reassuring you about side effects of the medication may be misunderstood as an attempt at even endorsing it, which I certainly don't.
Okay, Dr. Ingale, one of the questions we have is that at what stage somebody who's COVID positive be admitted to hospital for medical supervision or treatment? Because in unlike other illnesses where you generally get better as the days progress, this is kind of in reverse, where you have to be a bit more careful as the days progress. So when do you know that, okay, you might need more medical care? What's the bottom line?
Yeah. See, most of the patients suffering from COVID-19 infection, like 70 to 80% of those patients are asymptomatic, means they don't have any symptoms at all, no symptoms or signs of the illness. Those patients, if they are with no comorbidities and if they're able to monitor themselves well at home, should remain at home, okay? Unless if the patient is positive and the inmates of the house, their relatives and other people staying with them are negative, and they do not have a separate room to stay, because if a person is positive and everybody else at home is negative, then that person needs to stay in a separate room with a separate attached washroom, okay? They have to be isolated. These people can stay at home if they can monitor themselves. They have to monitor their vital parameters, the oxygen saturation, the temperature, and they have to download the Arogya Setu app. So if they are young people, if without any comorbidities and they are able to monitor themselves and stay in the separate room, they should stay at home only, because all the hospitals had been overburdened with COVID patients and we were short of beds because of so many patients. Then those patients who do not have a separate room, or those who are not able to monitor themselves and there are no caretakers for them, they can go and stay in the CCCs, which are meant for asymptomatic or mild patients to be isolated. Now, if you are at home and if you develop fever, if your oxygen saturation falls below 93%, or if you have symptoms, if you become breathless, or if the fever is not coming down, or if you're not able to tolerate oral medications, and if you vomit continuously, you have loose motions or other abdominal signs, then it is better you stay in the hospital. So depending on the stage and depending on the severity of the disease, whether it's mild, moderate, and severe, we have to decide. And if you're elderly with comorbidities like diabetes, blood pressure, cardiac problems, having malignancies and all, then those patients needs to be supervised closely, and those patients are better in the hospital. So if you are not symptomatic and you can monitor yourself, you can stay at home, but keep monitoring yourself. And if there's any change and deterioration in the clinical condition, then inform your physician, be in touch with the physician even if you're at home otherwise also, and then you can go and get admitted if there's any deterioration in your clinical condition.
Dr. Reheja, just coming back to that question we were talking about regarding anxiety, what is your advice to people who are dealing with this daily uncertainty while battling COVID? And as you rightly said, there's so much uncertainty about what the next day will bring, what the next few hours may bring. I personally found that taking things one day at a time and saying, okay, if my oxygen saturation is 98 today, that's a good thing, and I will sleep well and deal with whatever comes the next day. So just taking things one day at a time, I think personally helped me. But is that something that helps everybody? Is there any other technique one can adopt to just get through those couple of weeks relatively stress-free, if possible? Your mic, sorry.
Yeah, so I think you've said it very well. It is being recognized that an attitude of gratitude will help most people tide over the storm. And when you say that I check my blood sugar today, I check my blood pressure, I check my oxygen saturation, and if these parameters are within normal range, and if I'm not grappling with anything serious, then I have reasons to be thankful about. Also, it lies is people who have learned or who are in the process of mastering the technique of mindfulness and momentfulness, which is taking one day at a time literally, which means that you are learning the skill and the art of connecting to the present day, the present moment. The past is history, the future is mystery. What I have in the moment is a gift, which is called present. A present tense is a gift. So I need to, despite the challenges, and like most people are saying, it is very difficult to stay calm in the wake of a storm. There is a storm around, but if worrying could help, then we'll all worry together and hope for the storm to wash away. That's not going to happen. And if you're just going to sit and brood and worry, it's just going to take away your mechanisms and your skills to be able to deal with it. Another thing that's worked very well for most people are people who have figured a way to keep themselves occupied, who have a schedule, who have a structure to a day. So initially, about a year and a half back, when all of this came, there was ambiguity, there was pain, there was fear, there was work from home, or everybody needed to stay back home. We did all of that, and we lost structure to a day because we had to worry about different things. We had to worry about uncertainty and ambiguity in terms of what the future will hold for us. After this year and a half, now we do not know how long the battle will last. Hopefully, the third wave, as they are saying, may not be as harsh. The people have been affected, and if they are affected, there is naturally some kind of immunity, memory immunity that's imparted to them. People are being vaccinated. There are different viewpoints in terms of if the vaccination is also or can trigger the virus to mutate and have different mechanisms, because for the virus also it's do or die, for the humans also it's do or die. So to be able to win this battle, which may be longer drawn than what we imagine, I think we'll need to learn to take a day at a time with an attitude of gratitude, with learning to be thankful for the things we do, to work on our spiritual quotient. To It's very important. See, one of the best model of cognitive behavior therapy, which is spoken so much in the West about, and where you can connect with a therapist and pay them a dime, an arm and a leg for it. I think one of the best models come in the scriptures, whatever religion you belong to. I find Gita is one of the best model of cognitive remodulation and cognitive therapy. And Guru Granth Sahib or Bible or Quran, whatever religion you belong to. So it's very important to have that movement and figure out the mechanisms as to what's going to work the best for you. Pick up hobbies, small things like just going in the garden, just the garden outside your house, and being able to water the plants, just being able to get a new skill. I mean, there are courses galore. For the cost of a coffee, you could go and learn like a 10-module course from a professor of Harvard. When could you imagine to do that? Thanks to technology, at least we are communicating. We don't feel alone. We're not isolated. So I think if we look at the positive aspect of it, if we look at the broader canvas, we can emerge out of it by adding better skill set, by becoming more accomplished and more wholesome human beings, with some of the challenges that some of us may personally have faced or may need to face. There's been mortalities in the families. It's going to be tough for them. And we pray that they can also, it's humanity with humanity, and we want to stand by each other. This is not time for commerce. This is not time to
That's
take
very
advantage
important.
of the situation.
In fact, one of the things I also found was just reaching out to friends and family on a daily basis, asking, because I think every family that one knows now has been affected by this. And I think just a small message to ask, how are you doing today? How is your mom today? I found that again very, very helpful. We all formed support structures around each other, and I hope that can help other people too. Dr. Alice has a question. Dr. Alice, are you here?
Yes, ma'am.
Who's your question for?
It's a general question, ma'am. Good evening to all the dignitaries. My question is, Can ivermectin serve as a precautionary drug in preventing COVID? If yes, then why the government is not, say, promoting or popularizing the use of this or maybe something else which will work for the masses?
Okay, Dr. Reddy, would you like to take that on? A lot of debate about ivermectin, and I see a lot of people do ask this question that can be preventively taken. Is there anything that can be preventively taken for COVID-19?
Well, I will give my view, and then I'll also ask the views of the other people who are actually actively treating patients. I'm no longer actively treating patients. Well, as far as the evidence that is available globally is concerned, there is no proof yet from a convincing clinical trial that it's either useful for prevention or for treatment. A number of case series and some very small trials have been cited, and one meta-analysis has been cited that is effective in treatment, but it's a very unconvincing series of reports that have emerged, and right now there is no international consensus that it's useful either in treatment or in prevention, and that's why the WHO also has put up a note that if ivermectin is to be used, if at all, it should be used in a clinical trial setting where the evidence is still to be gathered. However, there are a number of doctors who are using it based on several reports that came from Bangladesh and elsewhere, and they are citing some evidence of benefit. But as of now, the National Technical Task Force of ICMR, guided by the All India Institute of Medical Sciences, has put it as a potential for something to be used in home care, but with very weak evidence. So that is where it rests at the moment.
Dr. Ingle, in your experience of treating patients, would you subscribe to the use of ivermectin or not?
As Dr. Reddy has correctly said, initially when we had started treating COVID patients, initially there were no protocols, no guidelines, and the drugs which were used were either experimental drug or repurposed drugs. And initially it was said that ivermectin helps in viral clearance. It's an anthelmintic for use for many years actually. And initially they said that it is useful for viral clearance. It works well with doxycycline, and that is what was reported from Bangladesh, and we had been using, and many people are still using it in combination with doxycycline, and they say that it helps in viral clearance. But as Dr. Reddy has rightly said, that there is not much evidence to prove that it either reduces the severity of illness and there is no effect on mortality. So nowadays, so also with hydroxychloroquine, I can say, because initially it was said that it's the best drug to be used for prophylaxis as well as for as a therapeutic agent, but now it's out of the schedule. Okay, it's not there in the schedule at all. So also ivermectin, though Maharashtra task force still has that, we can use it in some patients because there's no harm in using, but it's not been proven. So the controversy still looms. But then ICMR also said that it's yet to be proven to be effective. It's found to be not that effective, no effect on hospital stay and mortality. So that is why it's not being given. It's not recommended these days.
Dr. Parekh, I have a question before I come to the next question from the audience, which is that once somebody recovers from COVID, what are the tests, if any, that one is required to do? What do we need to be careful about in the months following? I would say, I wouldn't use the word recovery, but perhaps testing negative. Your mic, sir. Sorry, I know it's
yeah, absolutely. See, look, I'm an amateur in this, so I keep forgetting to turn the mic on. I'll certainly answer that. But before I do, Nidhi, I have a question for you. I can see that we're almost 70% of our time through in the discussion. And I see the questions are just piling on. Not meaning to be an anarchist, I'm just wondering whether in our free time, that is when we are not talking, can we just start answering these questions on the chat line?
You're most welcome to.
I mean, it means bypassing you a bit, but on the other hand, I'd like everybody who's asking a question to get at least some answers. So some of our answers, at least mine, might be very brief. Please do not construe that as a sign of rudeness. Just want to ensure that everybody gets an answer. And of course, you're free to ask those questions to specific panelists as well. So to come back to the question, what tests, in my opinion, no tests at all. You really don't need any tests to be done. At the most, for mental satisfaction, to settle down your existential anxiety and that of your family, perhaps you might want to get an RT-PCR done. it's really no great consolation because, its sensitivity is another issue altogether. Certainly do not go for a HRCT scan. It's not going to give you any useful information. And, it could be potentially carcinogenic because, it's the equivalent of 300 X-rays. Take Dr. Deepak Raheja's advice. If you've recovered, thank God, have gratitude, get ready to celebrate life, but not too quickly because...
The heart, any checkups you would recommend, like an ECG or an echo, unless you have symptoms, only then should you do it, or pre-existing conditions?
See, this is an overriding principle in medicine, which has been there for a couple of 100 years. Even before the advent of X-rays, for that matter, which are about 100 years old, and which continues by and large to have an influence and an impact in the algorithm to decide what tests to do. The clinical condition, Nidhi, always overrides tests. A test in the absence of a clinical state is meaningless in itself, because all tests have a certain degree of false positivity and a certain degree of false negativity. Since you mentioned the ECG, if we pick up 100 people on the street who are hale and hearty, the likelihood is about 15%, maybe slightly more, might have ECG irregularities, which mean nothing. Okay, but it could turn them into cardiac neurotics if they start worrying about, why is my ECG abnormal? So really, it's ideal not to jump the gun. If there is a clinical condition which is troublesome, talk to your doctor, your family doctor. If he thinks a test is required, only then get it done. But just don't rush randomly for tests.
That's good advice. Dr. Shailendra is here with the question. Dr. Shailendra, please go ahead. You'd have to unmute your mic.
Sure.
Thank you.
Good evening, panelists. There has been a lot of publicity by Ministry of Health that this Ayush system of treatment is very effective for COVID. So there are different again views on that, and the public is actually confused. I'd like to know from you your considered view on this.
Okay, Dr. Reddy, would you like to take that question? I mean, do you subscribe to any advice of the Ayush Ministry?
Well, any treatment that is being prescribed must be evidence-based. Till that evidence comes through in a convincing manner, either through very strong mechanisms that show influence and preferably backed by clinical trials of some nature, even if they're adapted to the Ayush system, because the Ayush system may have individualized approaches which are not necessarily amenable for group trials, but there are still some research methods which can be applied even there. So unless some of those are done, we cannot really go by the available evidence that particular intervention is effective or not. At the moment, I do not see that happening, and therefore I'm not going to contest the advice given by the Ayush Ministry, because they have their own right to issue whatever advisories they have. But that is not something I will endorse personally unless I see convincing evidence.
Let me ask Dr. Farah Ingale this question about vaccinations. And, we've seen the protocol being changed recently again, Doctor, with regard to the gap between doses and when the right time is to get a vaccine shot, first or second after recovery, which has now been increased for up to 3 months. Would you say that that's a good enough time frame by which to get a shot? Of course, now our concern is that we don't have the vaccine, so one should get it even after that 3-month period.
Yeah, whatever you said is exactly what actually we were also discussing. Initially, the gap between the 2 doses of both Covishield and Covaxin were 28 days. Then later on, the gap for Covishield had been increased to 6 to 8 weeks. And now recently it had increased to 12 to 16 weeks. Not for the Covaxin. Covaxin is 1 month. If at all, you can stretch it for another 15 days for any reason if you're not supposed to go on time. Now, mostly, see, there are 2 reasons for that. One is after taking the first dose, after some time, the antibodies start forming in the blood, and that remains in the circulation, and that will generate protection for you. And second reason, I think, basically, like the booster, the second dose is like a booster. And it is said that the antibodies formed can stay for up to 3 months and can take care till you take the next dose of the vaccine. The second reason I think is because we are short of the vaccine, and maybe because the government has to vaccinate more people, so that in case if they develop COVID, because after taking second dose of vaccine also, people can still get COVID infection, because no vaccine is 100% protective. So in that case, they want to vaccinate more number of people. So in case if they get COVID also, it may not be that serious. It can get passed out as a mild illness. And yes, the protection can remain. So if you take it by 3 months also, it will be useful. So now the gap has been extended to 3 months. That is for Covishield, not for Covaxin. For Covaxin, it is 1 month maximum.
Right. Dr. Nageshwara Rao Reddy has a question. I'll take that to Dr. Parekh. That how do we differentiate between a normal viral fever and COVID-19 symptoms? It's still very confusing. I have to say I agree.
I was just answering that on the chat.
Okay.
Oh, this is amazing synchronicity. How does one distinguish? First, let's admit that we cannot always distinguish, okay? Because, the symptoms can be similar. Obviously, my telling the person that wait and watch, if you survive it was ordinary viral fever, and if you don't, we know what it was. It's not a wise thing to say. So the way to make sure is there is a constellation of other symptoms, okay? And in that, there is a difference between ordinary viral fever and say the COVID-19 fever, although there is an overlap. So of course, you can get body ache, fatigue, all of which occur along with this. But, respiratory symptoms are by and large the hallmark of COVID-19. Since we're out of time, I won't get into the rationale for that. Suffice it to say that the receptors through which the virus gets entry into the body are most predominantly in our lung cells. So if there are respiratory symptoms, that's a cause for concern. Breathing rates are a cause for concern. Most people have oximeters. So if the oxygen levels start dropping, that is a cause for concern. And at that point, in consultation with your doctor, it's advisable to get the RT-PCR test, a word about it. If it turns out to be positive, it's very likely that you have it, because it's 99 to 100% of times right. If it turns out to be negative, don't just get reassured. Continue following all COVID-19 appropriate behavior to protect yourself and others, because there's a 35% false negative rate, which means you could have it and it could still come negative. So, that is clear. Now, finally, if you are to make an error, it's best to assume that it's COVID-19 rather than a viral fever.
Yeah.
And chances are it's a viral fever, it will just pass away in less than a week. And if it's COVID-19, might take a little longer. That's all. And again, remember what Dr. Ingle told us, that 90% of people are just going to have very mild symptoms. So let's not get into a situation where we are thinking of ICU and stuff like that.
Yeah, I think there is a lot of panic about when symptoms do develop. Gopal Krishna is on for a question. Gopal Krishna.
Yes, madam.
Yes. Yeah, Mr. Gopal, please tell me who your question is for.
Good evening, doctors. Yeah, I am Gopal Krishna here. As a father of 2 children, what are the precautionary measures can be taken against the second wave? And also, since I am going outside to purchase the home needs, when I return to home, I do worry about the virus. When it may use, whether it may use me as a medium to spread it. This is what the little worry I have always. Can you please?
Okay, you're worried about your kids, and rightly so, Dr. Reddy. In fact, I did want to ask about that as well, because there is a lot of speculation or a lot that's being written about the possible third wave that may affect children. And Mr. Gopal Krishna, as he says, is worried about infecting his kids. What precautions can he take since he goes out of the house? And what are your views on this speculation about a third wave affecting children?
Well, as far as his being a source of infection for his children, that's a legitimate concern. If he gets infected, he can then pass it on to his children. But the most important thing is he should not get infected. And we know why he may get infected and how he should protect himself. If he goes out for marketing or for any other work, then he should obviously mask himself well, properly. And if he is entering particularly an indoor location for a fair length of time, whether it is a shop or an office, then he should ideally double mask, so that in an ill-ventilated place where aerosols form and hang around for some time as viral clouds, there the risk of infection is more. Therefore, double masking is likely to be better than a single mask. But you should wear the mask most certainly and avoid crowds as much as possible. Physical distancing is not always possible, but you can always briskly walk through a marketplace without necessarily staying for a long time in a crowded group. And as long as you're avoiding those, then the likelihood of your getting infected is much less. And then when you come back home, while it is true that surface contact and fomite contact at this moment is not considered to be a significant danger, you certainly should wash your hands. You need not necessarily change your clothes or have a bath or something like that, which was originally thought of as possibly an important measure. But right now, the most important thing is do not get infected, therefore you will not pass the infection on to your children. Now, as far as the question of your children being more affected in the third wave, that is a matter of conjecture based on the probability. By that time, most of the adults would have been either exposed and possibly been infected, or because they're preferentially being vaccinated, a good deal of them would be vaccinated. And since the virus does look for susceptible persons, and young people would be very much more mobile at that point in time, unlike the first wave, they are certainly mobile now at the beginning of the second wave. But it is likely that they would definitely get affected in larger numbers because the virus does look for susceptible people. But by and large, the evidence so far is worldwide and even in India to a large extent that children do not get as sick as the adults. And therefore, the consequences are likely to be less hazardous. Of course, there is some speculation that some of these viral variants or the mutants are possibly also going to be a little more virulent, but there is no particularly convincing evidence that they are selectively targeting children. And therefore, the precautions that we observe in general for preventing the infection will hold good for everybody. And
Right.
I believe the most effective preventive measure for protecting our children is for adults to behave responsibly.
Very good advice and very sound
Thank you,
advice. There's a question from Spandana, which I think is an important question because I find often people have this misconception that when they recover from COVID, you're immune and you don't need a vaccine. Dr. Ingale, would you like to take that question on? If I've recovered from COVID, do I have to get vaccinated or do I have natural immunity for the future?
Yeah. So if you have suffered from COVID infection, you will develop some antibodies for sure, which will give you protection for some time. What was seen was with every 21 days or every third week, the antibodies start reducing in your circulation. And by the end of 3 months, most of the antibodies have gone up from your circulation. Or it may at the most get extended to 6 months. So what precaution you have after natural infection may be up to 3 to 6 months. So that is why, in spite of you having suffered COVID infection, you have to get vaccinated. It's very important that you should go for vaccine. Then secondly, if you had been infected with COVID infection, you will be immune to that particular strain of virus. But if you are vaccinated, you will be protected against different strains of viruses as well. And secondly, it's not like if you had COVID infection, you will not get COVID. As I've said, after 3 months, usually the antibodies are all gone. So there are chances of reinfection again. So in spite of having suffered from COVID infection and in spite of taking the vaccine, COVID appropriate behavior is very, very important. And mask, when used properly, serves like a vaccine. So along with vaccination, that is for real vaccine, the injectable vaccine which we have at the moment, later on we may have inhaled vaccines also. Using mask and maintaining social distance is equally important. So in spite of having suffered from COVID infection, you have to go for vaccination. And at the moment we have the vaccine where 2 doses are required, you have to go for both the doses of vaccination.
Dr. Raheja, one last question to you, which is, again, coming to how we're dealing with the fallout of COVID. One of the questions that someone has sent is that how do you deal with the loneliness that many have faced during lockdowns and being separated from their families? Many people haven't met their parents also for many months on end because they're also scared of infecting them, etc. And I think for our parents, those who are older, you're already dealing with these issues about mortality, etc. And it kind of comes home even further. It hits you when you're dealing with a pandemic. How do we wade through that?
So My advice to that is, of course, one needs to be careful. One needs to very strictly adhere to COVID protective preventive behaviors. But I think just over exaggerating everything might just make situation worse. Imagine COVID being there 20 years back with such technological advances not being there. We would be deprived, bereft of communicating with friends. With most people I know, they're doing group chats, they're doing video calls, they're doing group video calls. So it's important to communicate. It's important to communicate with friends. Nurturance of relationship has really helped people tide over the current situation. And for people who tend to ruminate and just delve into negativity, I think we need to also maybe perhaps do something about our media. Yes, TRP is important, and we need to talk about things that are happening around. But the whole day, if there is that play of horrifying, scaring news, I don't think it helps to generate the right neurochemistry, the right hormones in our body system, and that can be hugely detrimental to the HPA axis, I mean the endocrinal axis, which helps to ward off and keep our immune system intact and
Right,
strong so that
having
we
positive
can be
news, and I think, you know, I tweeted about this as well earlier, which was that, hey guys, if there are people who've recovered from COVID and are doing all right, please share your stories too, because we get overwhelmed with all the bad news and we don't realize that most people do recover just fine. And we need to hear those stories much more. So I take your point, and that's important. We have time for one more question on the panel. Is Mr. Koshteshwara Rao here, please? Mr. Rao?
Yes, ma'am. Good evening. Thank you for giving me an opportunity to discuss with the doctors. Okay. Actually, myself and my wife and other kids are also got infected with the virus. Okay. So we consulted different doctors. So one is regarding already it has been happened more than 1.5 months. So, but some doctors suggest we need to continue with the vitamins or vitamin C or even ecosprin. So some people say don't take for long time ecosprin, but the consultant doctor suggested us to take 1 month, whomever I contacted. Okay, but my wife, whomever she contacted, they did not suggest even ecosprin. But when we discussed with my doctor whom I have consulted, he suggested even for my wife also to continue with ecosprin. But is it advisable to take ecosprin?
Okay.
And also we need to continue with zincovit and vitamin D
Okay.
and vitamin C,
Dr.
and
Parekh,
because
okay, would you
hello.
like to take that on, Dr. Parekh? Are these blood thinners necessary for a long period of time? The vitamin C, the zincovit, the vitamin D, how long should one continue with all that?
Well, I did miss a part of the question because I was answering chat. So I'm almost through with them. So I think by the time you're done, we would have answered.
Very good. That's very good of you.
The questions. I missed the first part, though I did answer a question of Dr. Koteswara Rao on the chat line, not this one. But blood thinners again are a two-edged weapon. It's a decision that should be taken very carefully because hemorrhages are known to occur. Bleeding, let me not get too technical. Bleeding is known to occur due to the virus. If you use a blood thinner, that can increase the chances of a bleed. So I think the doctor needs to take a very calibrated call. As you know, Dr. Koteshwara Rao, we do it all the time, a very calculated call on whether it's required. But once it is given, I can tell you emphatically that it doesn't have to be continued forever. There are risks associated with taking it. And so it depends, of course, on the blood thinner and on the dose. For example, if it's just aspirin and it's like 75 milligrams or 50 milligrams, that's relatively safe. If it's something stronger, then of course it's relatively more dangerous. So this again is a very individual decision, but a generic reply is certainly not for a long time.
All right.
I just quickly want to add in about 10
that is
seconds.
good suggestion,
The way some of us went rampant in hoarding medication, popping too many pills. You know what will get to be seen eventually, that this vitamin C and zinc and other vitamins that people have gone overboard some of these vitamins are responsible for absorption of iron, and this ferritin, this iron, may provide a medium in which the mucormycosis tends to flourish, which in hindsight we may see may have contributed to the sudden rapid increase in these. So don't go overboard with medication. I don't think these vitamins need to be taken indefinitely. Just consult your doctor. It's very important to be in touch with your doctor.
Dr. Reddy, we just heard about these home testing kits, which are going to be available to test for COVID. Is there anything you can share on how accurate these will be? I know that they've existed in some countries in the West, but are you concerned that they will be as accurate as the gold standard RT-PCR?
Well, even the gold standard RT-PCR is about a 60 to 70% sensitivity. That means it can still miss about 30% of the cases. And the rapid tests have a lower sensitivity compared to that. So there is a good chance that the lower tests may miss about 50% of the cases. So the point that's been made earlier, that we must always look at the clinical status as well and judge what the overall probability is based on a combined assessment of the history of exposure to people with COVID, as well as the symptoms of the person himself or herself and the test result. But one convenience of the rapid test is that it can be repeated more frequently, unlike the RT-PCR. So one of the advisories given in the United States, particularly in Harvard, is that you repeat it more often, because one of the reasons why you get a false negative test is that very early in the infection and very late in the infection, you may not be able to capture a replicating virus. Of course, there are other reasons why it may be negative, because of poor swab collection, poor transport, poor storage in the laboratory, and so on. But because if you repeat, maybe after 2 or 3 days, you may be able to catch the replicating virus better than very early in the infection. They're suggesting more frequent, about possibly even 3 tests during the course of an illness to make the diagnosis. But it is far better to actually have the test done, but also depend upon the overall clinical features rather than just depend on the test itself and not be guided. And that's why we have seen, unfortunately, several people being refused admission to the hospital, despite their having convincing features, just because the test was negative. So that is very unfortunate.
Thankfully, that advisory was changed, although belatedly, some would say. But it was important that the government did take note of that. Thank you so much to all of you on the doctors panel today, Dr. Reddy, Dr. Ingle, Dr. Raheja, Dr. Parekh. Really very grateful to you. There are still, Dr. Parekh, you're a hero. You're answering a lot of questions in the chat box as well. So if all of you are okay, we can maybe send you the questionnaire of some of the remaining questions. And if you have time, you can maybe have a look at that so that people get answers. But really grateful to everything that all of you are doing in the medical fraternity at this difficult time. So thank you so much for taking out the time and joining us this evening. Thank you.